we wanted to kick off. We hopefully will do some more of these for the purposes of best practices sharing and kind of community building. And I thought it would be fun to start this off with some of our folks who've been on the front line since the beginning of this Facebook group phenomenon at Open Source Medical Supplies. The co-founder Gui Cavalcanti and our co-lead of the medical team at Open Source Medical Supplies, Angela Forgues. Now I just screwed that up. It's Angela, what is it?
Forgues. Forgues.
I keep thinking I want it to be more Italian, I think, or something, or Portuguese. Anyway, why don't we start with an intro, just a little bit, help everybody know where you guys are coming from, how you got involved with Open Source Medical Supplies, maybe a little bit just about who you are and your journey here so far. And I'd like to just encourage everybody to use chat for communicating your thoughts and questions. And then we'll be moving into a section of this where we'll be having a little bit more interaction while getting you guys on the main stage here. So go ahead, Angela.
Sure. So hi, I am in Milwaukee, Wisconsin. I am a health researcher and also a strategy professional. My training is in epidemiology, and I've actually done research on the 1918 flu. That was some time ago. I came to OSMS as the result of being a friend of Gui on Facebook and through dance, actually, from Boston days. And just given my background and experience researching the 1918 flu and in clinical research and healthcare more generally, that's how I ended up co-leading the medical team.
Great. Guy, do you want to give us a little intro on your background? And
Sure. So my name is Gui Cavalcanti. I've had many lives that are all very different. But relevant to this conversation, I started a makerspace called Artisans Asylum in Somerville, Massachusetts, 10 years ago now. I then started a effort within that makerspace to create a program with my COO at the time and co-executive director of OSMS now, Molly Rubenstein, with Make and Sabrina and Dale, to do a how to make a makerspace program of how to create makerspaces all over the world using best practices and patterns. Then started a crazy, strange company called Megabots, which was a viral entertainment robotics fighting company. If you ever want to see me wearing an American flag as a cape, there's lots of videos of that floating around the internet. And have been working in robotics since then. And when I heard about the effects COVID-19 was having in Italy, did the standard thing engineers do and said, oh, they're running low on this big, complex, shiny object called a ventilator. Why don't we go invent a bunch of those so we can make a bunch of those so we can solve this crisis as engineers? And then I called my college advisor, who was a surgeon in the San Francisco system, and she stopped me. She said, stop, don't bother with ventilators. We can't use a ventilator if there are no ICU physicians left, right? And her point was that hospitals in San Francisco at the time were already, this is 7 weeks ago now. Her point was that hospitals in San Francisco at the time had no supplies because they already had a bad flu season and they weren't getting shipments already 7 weeks ago, right? And her point was that, the broad issue is going to be that, one COVID-19 patient is hundreds of pairs of gloves, hundreds of masks, hundreds of face shields, right? When you look at the number of attending physicians and their PPE requirements, all of this math is probably very apparent to you all now. But at the time, it convinced me to switch the, Facebook group from ventilators to open source medical supplies as quickly as possible within the first 12 hours or so, and try to collect as many designs from the entire chain of supply issues that we believed we would have, so that they could be made locally. Because one of my fundamental beliefs, coming from robotics, coming from building technically complex things, is that we're looking at supply chain failure across the world, right? I stopped being able to build robots 4 weeks before COVID came to America, because when China shut down, it rippled everywhere, and we're building robots out of thousands of different parts, and suddenly we couldn't get a third of them. And if we're having this problem trying to build things that already exist, right, it's only going to get magnified. So my fundamental belief is that distributed manufacturing is one of the only ways for many parts of the world out of this situation, given the demands of medical supplies, and wanted to get a head start on that very, very early and find as many supply designs as possible in order to make this happen. So that's my background. I will just say straight up, I have no medical experience whatsoever. I have experience in virally growing things. I have experience in strange entertainment phenomena. I have experience in starting makerspaces and creating self-sustaining patterns for makerspaces. But any and all medical questions should be directed to Angela and the rest of the medical team. And I should not be assumed to have any broad depth of understanding related. So that's me.
Maybe we can get you guys then straight away into sharing a little bit about how you guys are seeing, you know, the what's on the horizon. Like what are you seeing? And this is all is changing dramatically, kind of by the day, if not by the hour. But right now, what are you guys thinking about?
Yeah, so my big thing right now is that we're starting to see, for better or for worse, you know, states opening up in the US. We're starting to see policies be relaxed across the world. We're starting to see second waves hitting the earliest folks who opened up. So Hokkaido, Singapore are starting to see new outbreaks. My fundamental belief is that this doesn't go away until there is a vaccine, until there is a treatment, and that we will be dealing with waves of this for a long time. And when I say a long time, I mean like 12 to 18 months. So just to set your expectations, I think this is a long haul process. And I think the really hard thing that we have to figure out is how much we can support over a long period of time without burning ourselves out, without destroying our own ability to make, right? And how do we transition from just supporting healthcare workers or just supporting essential services or what have you, and how do we build capacity to support larger communities, right? Because now we're in a situation where people are going to want to go outside. They're going to want to go out maybe to restaurants if they're opening up, maybe to, lots of other places. Are there ways that we can help support this? Do we just have to stop, right? Like what is the long-term plan here? And how do we make sure we can keep going? Because I know a lot of you are tired. I know a lot of you have been doing super heroic work, right? And it's super commendable. It's amazing. We have, so much support for so many of our communities now because of your work, but you have to be able to keep going. And that is a marathon, not a sprint, right? And so, we do want to help you figure out how this turns into a sustainable thing. Or if you decide, hey, I'm surge capacity, right? Like if the supply chain is failing, I can step in, right? But until that point, maybe I relax. Maybe I work on other things. Maybe I recover. In terms of actual supplies, we've seen, things pop up that we never expected. We've seen things that become tools and infrastructure for other makers, right? So making bias tape folding things on a 3D printer. It's like, what? It's like somebody actually paid attention to somebody else who needed a thing and came up with it, and then everybody started making it independent of any guidance from us. Awesome. Let's keep doing that. Let's keep building infrastructure for each other. So we're only more productive as a whole. I think that's great. The ear savers, right? Listening to your users being the people who have to wear the stuff day in and day out, making sure that somebody going to the grocery store and working an 8-hour shift while wearing a face shield doesn't come home bleeding, right? Like that's a super high priority, right? In terms of hospital settings, Angela will talk about this to a better degree than I can. Isolation gowns are huge. Isolation gowns in the US at least are not made by Chinese manufacturers. There is no Chinese supply chain for isolation gowns because Chinese approaches to that type of PPE are focused on reusable, whereas the US is focused on disposable. And the style of gowns that we use between the two countries is actually fundamentally different. And so every hospital in the US is running out of isolation gowns, right? Whether they're reusable or not. And that's something we've been seeing across the board from multiple hospital systems. The demand for disposable gowns that fit the same way hospitals are used to using them is way too high for the maker movement to ever consider. It's literally hundreds of thousands of gowns per hospital system in a state, right? So there's a conversation there about like, what can we even do? And what does it look like? And Angela can speak to that certainly way better than I can. But I do want to flag that like isolation gowns, caps, booties, right? Like the things that you wear to not get splashed are things that are being paid a lot of attention to right now. And I do think, you know, it is important to say, I think we've done an amazing job on face shields. I think we've done an amazing job on cloth masks, getting those out into the public. I think there's lots more work to do. But I do want to just commend you all and say like, yes, we're like answering those calls, answering those needs. There are makers now who are running groups of small and medium-sized manufacturers who are injection molding things for their communities, which is crazy, right? Like we graduated from the one person with an ender, you know, to the like makerspace cranking out on a supply line with folding tables, to that same person running like multiple shops with injection molding tools, right? Like that has been happening in real time across the US and the world. And that's amazing, right? And I think it is time to consider, okay, what are the societal needs in your area? Are we opening up? Are there needs for broad cloth masks? Are there needs for other kinds of things? And are there other hospital needs if you are supplying hospitals? Those are my big ones. Angela, you want to follow up?
Sure, and I'm actually going to make this pretty short. I just want to echo what Gui has said, and that this is absolutely a marathon and not a sprint. I've heard 24 months and longer for how long this is going to be affecting us. Historically, at least with the 1918 flu, we saw multiple waves. As Guy said, we're seeing this in locations already. So I would expect that. In terms of actual needs, as Guy said, absolutely gowns. But I also want to emphasize the fact that hospitals are going to continue to need face shields. Nursing homes need face shields and masks. Your grocery workers, your Uber drivers, your bus drivers. So in terms of, talking about what comes next, continue to focus on the things that you've already been producing, because as the states open up, those things are likely to be needed in a broader community. We're going to also see some more complicated designs or needs. Once we start solving for the gown problem a little bit, there are going to be things like pulse oximeters and CPAP helmets and ventilator parts that are going to be needed. And that need, of course, varies by location. And so just echoing again what Guy said, paying attention to your local needs is going to be vital.
Thank you, Angela. The chat room is a little quiet, so I'm not sure who out there is dying to ask a question, but the floor is open. So if
one quick thing, Sabrina, we did have some initial questions in that thread that I wanted to address.
Oh, yeah, let's do that. That's great.
So there's a question that was raised around like, okay, are we selling? What is the liability, right? And how do we do this long term? And I want to just tackle that head on. From my perspective, and if anyone has legal input here that says otherwise, please let me know. But from my perspective, as long as you are giving things away, there is a lot of liability you are shielded from, particularly if you inform people that you are not creating medical grade equipment in the first place, and you let them decide what to do with it. When you start selling things, there is a significantly higher barrier of liability, and it is a good idea to start looking at waivers and to start looking at putting sheets in all of the baggies that you dispense with all of your PPE saying this is not a medical device. This is not FDA approved. Your use of this is for your own personal use. We cannot guarantee its function, right? And I can't personally give you the text you need to create those liability waivers and to create those warnings in a way that shields you. There is probably a pro bono lawyer in your network who can help you for your region. But it is likely to be regional. It is likely to be, influenced at least by your state, certainly by your country. But all that being said, I do want to point out, you should, at some point, really think hard about what it takes to keep going. And I think for most of you, that starts to look like getting paid. And I think you should be thinking now about what type of payment you accept for what. Is it covering the cost of your materials, the wear on your tools, right? Like all of the other elements of manufacturing. Does it also cover payment for people who are doing this for 8 to 12 to 16 hours a day? If they don't have other revenue streams and they can't make rent because they've been working so hard for a month, right? You stop being able to support your community, right? So there is a business model to consider here. If you have, people who are working so hard that they can't support themselves otherwise, I think there's certainly a call to make it as low cost as you can in this time, but don't shy away from that. Don't assume that because you are makers it must be free, right? Don't offer yourselves up as sacrifice, because then a month and a half in to a thing that might be 12 to 24 months long, you stop being able to make something, right? This is about keeping yourself productive, keeping yourself able to run the marathon instead of just the sprint. And I think that's just really, really important to keep in mind and be upfront about. And I do want to invite Sabrina, if you're okay with it, a conversation around that for at least a little bit, because I know people have questions about liability. I know people have questions around how much should they charge, things like that.
Yeah, and I think there's probably people here that are maybe already venturing into that, either through fundraisers. Maybe somebody could share some examples of how you might be, if anybody's moved into that around selling or getting donations as a way of funding what you're doing, and or the legal stuff. I think we saw, Marcos, you were talking about your disclaimer. Maybe you want to talk about how you got there.
Yeah, sure. Hi, everyone. My name is Marcos. I'm from Arizona, here in Phoenix. So my lawyer created that free and legal disclaimer. I'm part of the running of OSCMS-AZ is really just trying to make sure people understand what that FDA EUA allows them to do. And like Gui said, that the as long as you're donating, it seems like from what my lawyer and another lawyer on our sub team has said, you're shielded mostly by what the FDA has put down, and making sure that, you know, body contacting items are, you know, marked. You know, when you hand these items over, you either have some sort of fact sheet that says, hey, you know, this was made with PLA, and your body's going to be touching, you know, these surfaces. And I think I've seen a lot of discussion about, you know, making sure that has happened. So I think everyone understands that. Feel free to use that disclaimer. Feel free to give it to your lawyer. Like I said, that was just created by my lawyer. We had another lawyer take a look at it from our sub team, and he thought it was pretty good as well. I guess my thing is, and my question is, you know, in terms of selling, I think it's unsustainable for the next month to be doing this for free anymore. I'm having people drop out who are some of my best people who are churning out, you know, 200-300 face shields, you know, every day or two. And I guess my question is there a way to maybe pool resources to get resources on CGMP and CFR guidelines and resources, so that, you know, we can transition from a couple of people in a makerspace or a couple people, you know, in a lab, to being able to actually exist after the FDA pulls the authorization? My concern is to keep face with the idea that we're opening back up for business, you know, against medical advice and scientific advice. I'm concerned that's going to happen, and essentially most of our liability shield disappears, because you know, that's really this is really allowing us to donate whatever, as long as you essentially don't dip it in gasoline and you don't provide something that's toxic. And I'll go ahead and mute myself, and I guess I can, you know, see if we can want to answer that question right now or later.
Does anyone else want to take a stab at sharing their situation in regards to that?
I could share from New Jersey, if everyone can hear me.
Yeah, go ahead.
So my name's Kevin, one of the North Jersey OCMS leadership, also medical resident. And I'm working with the Montana Face Mask New Jersey contact, who is trying to push this mainly for nursing homes. So throughout the state, you know, he's been having contacts with different healthcare facilities to basically validate with the fit testing that this can be used viably. It's been having good success with some nursing homes, and, you know, as the issue is with funding, that's kind of been the issue we've been running into. But we've been trying to convert his company to a nonprofit organization that can potentially be eligible for grants provided by the state for like a pandemic relief fund. For example, there's one being launched by the First Lady, up to $2 million of grants that's being allowed for. One of the uses could be for making PPE. So right now he's trying to have a big push, you know, through the state government in New Jersey to see if we can have something viable like this. And I myself am trying to push this within my own hospital system to see if they would be willing to do something like this. In terms of the mask itself, he always wants to make the mask itself for free, and that would be the basic Montana mask. And then in terms of a business model, just running through ideas, you know, it could be something like, if they want to customize the mask, have it different colors or engravings, that's where, you know, the charges could be in. Even for like filter pieces, for example, like most of what we provide is just, well, he provides just the Montana mask itself. But if you want filter pieces, that's where he would charge. He's thinking that maybe for individual private practitioners who are now trying to return to work. So for example, he's been getting a lot of requests from dentists or like oral surgeons, for example. He's thinking that maybe he would end up just charging them to help kind of sustain this business model. But this is kind of just like in the planning stages right now. And I kind of post a little bit in the Slack of what we're trying to do. So that's what we're doing in New Jersey, and want to know if anyone has opinions about that.
I want to say something really quick about incorporation that might help. Typically, converting a for-profit to a nonprofit is a heinous endeavor that could take a year, easy. Starting a nonprofit from scratch is also a heinous endeavor. And at the asylum, it took us 2 years just to get our 501c3 status. The most effective way to get functional in the nonprofit space is to find a fiscal sponsor, which is a group that you sign an agreement with to be your fiscal sponsor. Usually they will take something like 5 to 10% of your revenue, but they will do your accounting for you. They will lend you their 501c3 status. They will serve as the nonprofit in your name. Usually it has to be related in some fashion, right? So like some medical or like fabrication style of nonprofit. You can potentially like, yeah. I'm sure there are a number of people here who have example groups that they've worked with, but that kind of setup can get you off the ground in like a couple of days, as opposed to a couple of months to a couple of years. So in terms of quickly getting a nonprofit status, that's where I would go first. And I also, there's been a lot of success in the Bay Area for related activities around pay what you can. Cause like not everyone needs a free thing. Like your dentist does not need a free mask, right? Like probably if a grocery worker like needs one for themselves, it would be great if you can give one to them for free. But I would say, you know, like don't restrict yourself necessarily from that revenue. If you can work on a sliding scale, that's great. Because I know there's a number of groups in the Bay Area that are doing things like resource sharing or like combined grocery shopping, where like people working at tech companies that have nice paying jobs are like, oh, I'll support like 4 other people. That's fine. Like we all have to get through this together. So that'd be my feedback there personally.
Thank you.
Go ahead, Kevin, sorry.
I just wanted to say thanks. That's actually really good information to try to pass on.
Anybody else want to share a little bit about what they're experiencing?
We've been charging here in
I can
Ashland,
share.
Ohio as well.
Hold on one second. We've got Josh.
Why don't you go ahead?
Oh, you want me to go first, Josh?
Sure thing.
Okay, thanks. Hey guys, my name is Landon, and I'm from Canada. I started off and got involved like many people, trying to support volunteers and groups of people around me, with what could make a difference. And so I was part of a Canadian group, and now I'm a part of a Canadian Alliance. Basically, that's a group of other people that are trying to do the same thing: pick up drop-offs, donations. And where we sit is with a group called Crown International. So we're building a software platform right now, and that can take pulls and needs and sort of act like a marketplace. Anyways, I just want to kind of reiterate what we've seen is the importance of this to be something that's financially sustainable, and that this be, like our laws in Canada are a little bit different, but that people create social enterprises is sort of my background, and there's a lot of paperwork.
Hey, Landon.
I was up all night last night in this hackathon, so I'm sure I'm not making a whole lot of sense right now.
Well, also your connection is a little bit weak, Landon. So, you're kind of cutting in and out. Why don't we have you contribute through Slack, and let's go to Josh.
If this will unmute, can you hear me okay?
Yep, crystal clear.
I am located here in Ashland, Ohio, and we're really a fairly small group. I mean, I saw this as being a need nationwide early on. And I said, you know what? No one's too big or too small. It's going to affect everyone, even if we don't have a lot of cases here. So I engaged some of the nursing homes from early on. And of course, with their very weak supply chains, we could see face shields, all PPE. It was an issue across the board. So we were a lot smaller than most of the other groups that I would see out there. I mean, we have, a couple dozen volunteers. We've produced around 1,600 face shields so far, and our rate's starting to pick up. We could probably print enough if we had everyone running full tilt, a couple hundred a day. But as some of the other members have already mentioned, we've had some of those volunteers start to, kind of drop off. I don't want to use the word slack off. Frankly, we pushed them so hard, for these folks, it's not super sustainable. Now, we've been charging for our shields from day one. Those are only around $3, which is, covers the materials, plus a little bit more to be able to buy more printers, buy some of the other supplies. I cover all of the filament then and send that out to all of our volunteers. They show up with parts. And we've built an awesome dashboard, which Sabrina, I know I mentioned, I want to share here down the road once we're ready, to be able to really see what's happening. So for a small group, we've got a lot of organization, and we've treated this as something that has to be not a business, but be financially sustainable from day one. Well, as I'm seeing those volunteers start to drop off, we pulled new ones in, we push them hard, and we, get a lot of output still. We still have to be able to find a way to grow this more, because we're getting hit with more and more orders, as some of you have mentioned now, from every dental practice, every individual practitioner who may have had his office closed. And then of course, retail employees, everyone else, they're starting to hit us now. So we finally made a website so folks can order for local pickup here in Ashland. I'm working with the local community to centralize our operations to another location, so that we can actually have a pickup location that's, not running by someone's garage, and try and make this whole thing a little more sustainable in terms of logistics. But I think it's extremely important that, we do charge from early on. And we are actually looking now as a business, my background is mostly IT consulting. We are looking at, we're actually creating a new LLC to start to produce these on a little bit higher volume for a larger area. So we're trying to use some of the donor funds to keep prices extremely low locally. We're still going to do everything we can to keep those costs down and make this sustainable. But frankly, I see a need which is so huge that, I think we can help folks out in a larger area, pull more volunteers in. And, there's two lines that this could go, between being all volunteers and actually being a business movement. And that's one that we're starting to investigate.
I'd love to tag on that. So one of the big things that I want y'all to understand is that the act of doing stuff first has meant that you have created a network of trust with all of the people that rely on you, right? And them asking you for more doesn't actually mean you have to do it yourself, right? You are all, I guarantee you, swimming in a sea of manufacturers who are able to do this much better than you can. I'm not trying to downplay your ability, but you are surrounded by injection molders, you are surrounded by professional machine shops, you are surrounded by, folks who are mostly probably idle if, you are in lockdown. And one of the things that you can do, one of the things that will preserve what you have built, is you can start contacting these people and arranging for them to start producing things. You know who needs things, right? So you can start acting more as regional level organizers and less as the regional manufacturers, right? And you can start connecting manufacturers to the people who need them, right? Because now you have a web of people who all trust you, right? And that is a crazy, awesome thing. And you can either be a central point that is distributing that, or you can be, the glue that ties people together, right? You can point a manufacturer at a hospital. You can point a manufacturer at a dentist. You can point your connections to suppliers that you trust, and you can expand the web of trust, right? I want y'all to very much keep in mind, you don't have to supply tens of thousands of things to your communities, and that's not how this scales, and that's not how this works, right? Like, we, from the beginning at OSMS, aren't making anything, right? We are organizing, we are providing information, we are trying to build infrastructure under ourselves to actually get to the point where, you know, local groups are responding outwards to support their communities. We encourage you to do the same, right? Because that is how you keep building these structures, and that is how you keep building these networks of trust. So, you know, please don't think the only possible outcome for you is, you know, like 18-hour days on the laser cutter to try and desperately meet the demands of, you know, a major metropolitan area or whatever, right? Because, like, that's not how traditional manufacturing works. But I do think that, you know, start thinking laterally, not just about how do I get more volunteers to come into my makerspace, but how do I get that injection molder down the street to fire up their machines and make a mold? How do I get that, you know, sign cutting group that has, you know, like CNC knives to start making those face shields for me instead of me? And maybe it's donations, maybe it's, you know, pay, but, like, you know, just keep in mind, all the demand in the world does not have to be met by you. It can be met by groups that you work with, but you have to get out of the emergency mode. You have to get yourself out of the mindset of, like, I have to respond. I have to, like, be the one handing the box of supplies to somebody else.
Yeah, there's a model in Chicago where the makers basically have started to manage the manufacturers, and they're managing the orders to the extent that they have those relationships of trust, and then they're managing distribution as well. Those folks aren't in the room, but maybe someone else wants to share. Peter's asking a question. And I know we also had, Marcos wanted to ask a follow-up question as well, and I promised him to go after Josh. Marcos, are you still there?
Yes, I am. Thank you. I guess my follow-up was, you know, whether you go nonprofit or LLC or some other sort of venture, my thing is, how long do we think the FDA EUA is going to exist? If we think that all the global manufacturers will meet the need that essentially we are providing, and I know some people through the Facebook group have essentially mentioned that they are the supply chain in their area. I know in Arizona we have huge issues. We have huge issues with the Navajo Nations and the Tohono O'odham for one reason, and that's because they're so rural. They're so kind of, you know, they have a central organization, you know, the Navajo Nations, the river people and whatnot, but their communities are so spread apart that their a regular supply chain, whether it's in, you know, somewhere else in the United States or whether it's overseas, doesn't get to them in time for their needs. So if we think the EUA is going to exist until the end, until a vaccine is created, then I feel like we can continue to work essentially with the limited way, the disclaimers that people have posted, you know, the very little CGMP FDA requirements that people have been meeting. But if we think the EUA will be gone in the next month or two, or the PPE need locally in some places will outstretch the ability of manufacturers to meet those local needs, then we really need to consider, you know, certain groups going full scale FDA certification to whatever level they need, because I mean, the only reason we can do this, right, is the EUA. And essentially my thought is that they swung the doors wide open. They opened up the dams and they're letting all the water rush So at some point, they're going to have to close the door, and they're going to swing hard on relooking at actually doing what their job is, right? Which is making sure products meet certain standards. They're going to go back to, they're probably going to overcorrect and go to extreme regulation and overregulate. And that's where we're all open to liability. And there are some people who are more open to liability because, you know, they're making, you know, like the masks. You know, personally, I haven't touched like any masks that have like an N95 quasi sort of mentality. You know, we're just making, I just focus on the cloth masks because it's reasonable to assume that a cloth mask that has a Peppa Pig print is not going to be N95, right? But if you give somebody a mask that has all these features and whatnot, well, they can leave with the assumption that it is an N95 or better. And that just opens up to liability. So I guess my follow-up was, do we think we're going to actually have, some people actually need to end up at an FDA level for the duration of this crisis?
So, Angela, you can follow up in a second here, but I just want to say I have been on the phone with the FDA, and you have never seen people more freaked out. like they are in crisis mode. They are accepting all comers in a way that has never happened before in the history of the FDA as a whole. They understand at a fundamental level that people are not getting supplies and that everything is helping. And we see sewing patterns on the CDC's website, right? Like we literally see, you know, the CDC and the FDA moving in ways that they've never moved before. I will certainly give y'all a heads up if I see any of that changing, right? And we have the connections to know like that, you know, such high level guidance would change. And we can make requests very deliberately to the officials we've been talking to at the FDA to say like, hey, if you see anything like this on the horizon, let us know immediately, because, you know, like they aren't in the business of trying to get you all in trouble, right? They're in the business of trying to save the US right now. So, you know, we can certainly keep an eye out for that. It is worthwhile to not only provide disclaimers, but I think probably to also provide guidance around what the things you are providing are good for. One really common misconception that I see in a lot of places is that cloth masks are personally protective equipment. They are not personally protective. You do not get filtration from a cloth mask. A cloth mask prevents you from coughing on people and prevents you from like spreading droplets to others. And they only work if you have a critical mass of people, or critical mass of people wearing the masks, so that they're not coughing on each other, right? So, you know, disambiguating that kind of thing of like, this is what this is used for, this is what it's not, right? Saying things, if you're making Montana masks, like, you know, typically this is tested before it's released. Typically it goes through a QA process. You know, we can't guarantee this performs like an N95. Like having that kind of information available up front is pretty huge. And Angela, I would, you know, love for you to talk a little bit about the types of disclaimers you would recommend makers provide for the kind of equipment that they're making, because I know a lot of people who are concerned about that.
Yeah, so first I'll just state, like, I am not a law professional. I have just been researching some of the disclaimers that folks have been using. And so I would encourage all of you to connect with a lawyer locally in terms of just the language. I think that's just generally a good idea, even if you do start coming up with your own language, just having them review it. A lot of well, there are some lawyers who are offering pro bono services in this space right now, who will, you know, be happy to look at the disclaimers that you're using. in terms of the actual disclaimers themselves, following the EUA guidance to a T is very important. And I would encourage you to connect with others who may be making a similar design. If they have, if we talk about face masks and the EUA guidance there in terms of just assembly requirements and what that looks like, if you can borrow or connect with others, I would encourage you to do that. I think that simplifies the process a little bit. But in terms of actual disclaimer, again, I'm not a lawyer, but you do definitely want to cover yourself in terms of, stating that there is an EUA, showing what that EUA requires. If it's PPE, the FDA in a lot of cases has been recommending just that folks state that the user is using it at their own risk, and that it is not has not been tested or regulated in any way. That has been sort of the general, and there is some language that you can find for that, and I can always direct you to the exact language that the FDA has made to others. But again, in general, I would encourage you to always follow up either with the FDA or a lawyer with regards to the disclaimers.
And I will also say, on our part, we are now looking explicitly just at medical supply designs that hospital systems have actually tested, that have gotten all the way through the process with at least a major hospital system that has the ability to characterize the interaction of the virus with the thing that is being made. And we are focusing pretty exclusively on promoting those designs so that when you are providing these things to people, you can actually, print out the sheet of paper that comes from the hospital on its letterhead and say, hey, this hospital system is using these for this purpose, right? And we are building them the exact same way. And, offer that as well, right? Because there are now a number of hospital systems all over the world who have said, hey, yep, we're using this. We have a desperate need. And there are hospitals that range from, small scale, city hospitals to like major level 5, like hospital system, entire chains in the US that are now approving these things. So we're going to be focusing pretty explicitly on those designs. And we'll be sending out some updates to our medical supply guide very soon that make a lot of that clear. So we'll be announcing that, but it is a top priority thing for us. And I will also say, this didn't exist 7 weeks ago, right? Like major hospital systems had not even imagined, DIY PPE as an alternative 7 weeks ago. So the fact that we have these now, and we have, people like MGH taking, homemade PPE through the ringer and actually coming up with medical guidance around it is like world changing. Like nothing like this has been seen before. So, we're going to be promoting that as fast as we can, just so that everybody's aware.
Well, and just to follow up, I would say that the other thing that is useful to know is just that the liability is different if you are distributing or making for a hospital versus for the bus driver, right? So there is community use versus like intended medical use, right? If it's intended for medical use or within a medical environment, then we get into the medical device territory. If you are selling to, a person in your community or donating to a person in your community, your liability is different there.
Great. I was being mindful that we have like 8 minutes left on this hour. I know probably a lot of us could keep going for quite a while. Wondering if anybody is being alarmed or challenged by new market needs in their area or new demands. Like, what are you seeing? If you've been doing face shields, are you getting asked for booties? Like, what's happening on the ground where you are?
Sabrina, can we pause that for just a second?
Yeah.
We did have a request for surgical gown information. Angela, I know you have a lot to say about that. Can you take a quick second to talk about our state of surgical gown information?
Yeah, so we have presently been updating the gowns information. And if you have particular questions about that, actually, we have one of the folks who has been helping me do that research on the line. And so we can answer specific questions with regards to potentially materials or testing standards. And potentially some designs. But again, I would say, you know, questions in that respect would be better. The need is significant with regards to both isolation gowns and surgical gowns. And the guidance, the EUA guidance for what you call a gown, right? Isolation versus surgical is very different, right? And they have different standards that you need to meet. And so if you are interested in gowns, you know, we will be releasing additional like research and information. And I would encourage you to very carefully follow that EUA.
Anybody like already pivoting into gowns?
I believe we have Sarah Miller on. Oh, and there is.
Yeah,
Go for it, Sarah.
we are making gowns right now. That's what's happening behind me right now. What's up, Gui? This is your old stomping ground, buddy. So we are at 3,000 right now. We are selling to hospitals for about $250 a piece, which is what we are, which is basically cost plus about 10%, and it covers just the food for the volunteers. We are basically covered over our through our nonprofit, I believe, is what I've been told, legally covered that way. We do have disclaimers, pretty hardy disclaimers on both our sales sheets and our labeling that goes into every single box. We label our gowns, for instance, as non-sterile protective gown. We're leaning even towards non-sterile protective garment. We're staying away from officially using the word isolation gown because I believe that that carries with it a promise of a level 1 or a level 2 that we're not prepared to promise. But I do put information right on the label that's like, hey, level 1 and level 2 is this, and ours passes that test. But the only tests that we really have are the recreation of third-party standards that we were able to find online and then recreate in-house. And we can just show, if anybody asked, the backup, hey, here's how we did the test based on the same AAMI standards that we found out there. So I'm interested in knowing more on how to label these correctly and keep us getting out of almost even just civil suits going forward. I don't know anything about that. But we are certainly supplying to medium level hospitals like Boston Medical Center is a dire need. It serves the lower income folks, and they're taking up to 40,000 of ours. I'm looking to make this as big as we can, having the most number of people making. We have a one-piece pattern that we're actually using landscape fabric readily available at your local Home Depot, and we've pretty much gotten donated about 15,000 yards of fabric from all over New England. Just walking in there and being like, give me all your stuff. And anyways, not sure how to answer any other questions, but I'm open for it and would be very interested in helping anybody else set this up now that we know exactly what kind of tools to use and what doesn't work. Were there any other specific questions? I mean, that's just the general bracket.
No, that's great. I mean, I don't know if anybody had any follow-up questions. I think we're willing to go for a little bit longer if people have other questions they want to address. That's awesome. Thanks for sharing your walk around. That's really great, Sarah.
That's our plan. Sure. Oh, let me start my microphone off. You guys can keep talking.
No, it's great.
I'll just walk around.
I think there were a couple questions in the chat.
This is crazy, by the way. having founded this space, you know, those are tarps over laser cutters.
Yeah, totally. We definitely have gone like the extra step, like under here is like the standing table, like right under here. It's kind of funny, our little bandsaw, and these are all set up for making masks for like Comic-Con, and laser cutters, and like the machine shop is right over there that you set up, brother. And so it is funny to try to only take pictures from places that it will look like this is much more of a sterile facility than it actually is. If anybody's interested, I'm welcome to share this. This only really has to do with gowns, and I don't really know if you guys can see this at all, but we do put disclaimers here and things like I was referencing here, like untested. We put our standard, like our methods here. I've shared this with you, Angela, you're familiar with it, but like you guys were referencing earlier, it's meant for nursing. It gives design details of what this is. It talks about latex-free sizing. And then some of the, since we're getting ours outside of the medical industry, this is what we could say was the standards for our like non-woven spun bond polypropylene, and what we were able to find out on that, the like standards sheet that we were able to find. So we do provide as much information as we think is basically what you'd find on a normal, but I am pretty nervous about this coming back to bite us, because I don't know in what ways we're covered. So if you guys, I don't even know who to contact. I just know that our guys say that I'm covered, and I'm like, yeah, but like from civil, like what? Like how? But anyways, I'll turn it back to you guys for any thoughts or follow-up, but feel free to contact me if you guys need anything, because we're here doing it.
I'm realizing I haven't done a Zoom moderator role in a long time, and I'm seeing these hands ups, and apparently Dorothy's had hers up for a long time. I'm really sorry, you guys. We'll be better at this next time. So I think this question about whether makers are going to pivot into gowns who have been making face shields, whether that's a culture fit, is really interesting. But there's so many seamstresses out there, so I'm wondering about that. But Dorothy, why don't you go ahead?
Well, I was typing in something that was in response to this. So Max wrote that in the DC area, some of the makers feel like they're not able to pivot, even though they were sewing masks, they aren't able to pivot to gowns because it actually is a different type of making. And so one thing that Nation of Makers have been chatting with some folks about is the idea of possibly figuring out if there are ways that certain maker spaces could be deemed sort of centers of excellence. And again, I worry about, you know, to what Sarah just said, like too much formality actually could bite us in the butt, right? So I don't want it to be so formal that we're like, oh, we're knighted something and then everyone has all this liability. But I think that there's, you know, this idea that not every makerspace does the same thing, and some do it really well. And it might be actually, you know, better for, even though we're trying to look local, that in some cases it still may be better to have a particular makerspace that's the leader and sort of establishing what the best practices are in a particular type of made good. And I don't know if that came up at all in OSMS or not. What I wanted to quickly just say though, as a challenge that I've been hearing that hasn't been brought up on this call, is that in partnership with manufacturers, there's some feedback that the manufacturers are not, the types of documentation that we have as makers is not the same level as, for example, a factory floor. So like, we don't necessarily all have factory designs. And so that some manufacturers have kind of been somewhat dismissive when makers have tried to partner with them, because, and some of them have been eager to work with makers, but they're just like, I don't understand the language. And having never been a manufacturer myself, I'd ask questions to kind of get to what are you looking for, but that may be a challenge in terms of that integrated ecosystem that Gui was talking about earlier. And so that was something that I just wanted to bring up as a challenge that we might want to think through as a community in terms of how we document the things that we're doing, so that it might make it easier for us to have that integration. And finally, the last thing I want to say, sorry, I had my hand up so much that I like I've had 3 different things to come up. The third thing is just that, so some spaces are using a Robin Hood model, and I actually really like this idea. So it's not really robbing from the rich and giving to the poor, but it's the idea of charging, healthcare centers and other places that can afford it. So to Gui's point, your dentist can afford it, to give to other spaces or other organizations like homeless shelters that cannot. And I really love that model just because I think that a lot of makers really rush to the cause because we care about our communities deeply. And this is a nice model to be able to continue to have sustainability, but also to take care of the people that you love in your community and that need you the most. So I'll stop talking.
Awesome. I just also want to share, I think Angela has to roll. So Angela, do you want to say goodbye?
Yeah. So I just want to, thank everyone for everything that you are working to do in your local communities. I can't tell you enough how important all of this is for the folks who are in your community and in need, and also, the clinicians who are on the front lines. So again, thank you, and I hope to speak with you all again.
Thank you
Bye.
very much. All right, let's roll into, go ahead.
I want to respond to Dorothy real quick. My background is in manufacturing and mechanical engineering. So we have spun up, just so you all are aware, we have spun up an effort inside OSMS that isn't super public yet, to have a technical documentation group that does nothing but pull in all of the random YouTube videos or JPEGs or like cartoons or what have you that tell makers how to build things and pull them into technical documentation packages that can be handed to manufacturers. So we are in the process of ingesting a whole bunch of open source designs that have had hospitals test them. And we are turning them into design packages that include both a like step-by-step, how does a maker make it, but also like, here are the DXFs, here are the assembly instructions, here are the, STL files, right? We also have a small collection of manufacturing grade plans. We know of a surgical mask that is actually at textile manufacturer scale. We have offers from a few folks for injection molded tooling plans for visors. So that is coming, just so you're aware. We do have some of those plans like in the pipeline. It takes a little while to build them up, but we should be able to help in that capacity soon. And in the meantime, if you do have specific asks around a type of thing that would be great to start building up, let us know, let Sabrina or Jadon know, and we can try and get you very specific things before they're all the way through our process.
Why don't we, Aiden Hill, did you want to
Yeah, please, if possible.
go for it?
I just want to say thank you so much for having this. I've learned a lot from this conversation. We don't always get information like this where I'm at, but I want to say thank you. I guess I have a question about how to deal with PPE specifically for homeless people. So I'm a part of a neighborhood association. We take care of a green space that's 2.8 acres, but we have about 30 people who are sheltering in place there while they're unhoused. And so I was wondering, what are some of the best practices for PPE for like kitchens, for example? Like, how do we make sure that we design containers if we don't have the money to buy them? Or like public restrooms, for example, how do we make sure those are sanitized consistently, especially since we don't have anyone else sanitizing them for us? And I'm just really curious, like, that also brings me to like, how do we make sure that people have electricity? Because some people have wheelchairs and other people need to keep their phone on to contact their family members. But I'm wondering, how does a community develop those items without support from like the government or a large donor? Thank you.
That is a lot of things. Okay, so in response to some of them, I just want to talk about best practices around the virus, because I think that will help. Being outside, first of all, is actually a gigantic help. So I can dig up the study, but basically there was a study on outbreaks in China that surveyed like 320 cities, something like 2,500 outbreaks where they were defined as 2 or more people got sick from one person. And what they found was that 0.3% of all of those outbreaks were the result of being outside. There is a gigantic component here of everybody being inside and recirculating air that is fundamental to how this disease spreads. If you are starting from the position of being outside, you are in a better place. If you are starting from a position of being exposed less, you are in a better place. Any type of aerosolization of this virus is terrible. So breathing heavily in close quarters, breathing heavily in like a gym, for example, where there's a bunch of people breathing heavily all at the same time. Like that is like the worst case scenario. Spreading out, having non-recirculated airflow, having continuous airflow helps a lot, right? Of like drawing in fresh air, exhausting it out, never turning it back around. Again, getting masks on everybody as quickly as possible, as herd immunity, not individually protective things, is super critical. So things like, if you have a population outside, making sure everybody has and wears cloth masks correctly, teach them how to do it, right? Like give them a little diagram saying this is how you wear a mask. Even if you think they might know already, like just assume, make something as visual as possible, right? So that they can, so yeah, those are my big ones. The only other thing I would say is if there's a high risk thing like cleaning something, like spraying down a restroom or whatever, like have that person wear individually protective things, goggles, N95s, something over the N95 to prevent splashing from contaminating it, right? Gloves. That is a high risk activity, as opposed to just being around each other, which is a relatively low risk activity, especially if they're outside. So that's my take. I have no answers for you on building up larger capacity for unhoused communities. That's a much harder thing to tackle. But yeah.
Okay, that's great. Thank you, Gui. I think Nick still has a hand up.
Hi. I'm sorry I was late. I'm Nick Harrow. I'm with Vancouver Makers for Emergency Response up in Vancouver, BC. Thank you so much for having me. Actually, to respond to Aiden, so one of the local connections we made here was Burners Without Borders. This is part of the Burning Man community. They have local chapters. I'm gonna guess that they also have a chapter in the Bay. So it might be a good idea to reach out to them. Maybe they can figure something out in terms of potentially even working with, well, from a generator to solar panels to generate energy for just charging phones. Obviously, electrical wheelchairs or scooters are going to be a little bit harder. But yeah, that's my immediate thought. I've been monitoring the chat a little bit, and I figured that I might be able to offer maybe some inspiration for the way that we do things here in Vancouver. Femurs has sort of taken the social lead within the so to speak, conglomerate of local maker initiatives from, well, we have our own sewers group working on scrub caps and headbands. We have BCC 3D, a 3D printing group that's making face shields. And there's also a large sewing group making face masks with particularly vulnerable groups in mind as well. We have one foot in the maker community, and the other foot is in the projects and engineering side of things, where we have a very close partnership with OSMS or OSCMS BC, OSMS BC, where they actually ended up focusing on getting a lot of the connections to the local manufacturers. So we do have a lot of scaling, both horizontal and vertical in that regard, with a lot of connections. Femurs has sort of taken the role in doing a lot of outreach and seeing how we can connect people in groups more specifically, including where BCC 3D has a completely distributed model of 3D printers who make all the frames for the face shields, and then connects them to PETG sheeting and then delivers them. So yeah, that's what I quickly wanted to share. Having basically the lessons learned for us is doing a lot of outreach, making a lot of connections, getting getting a lot of the maker communities to converge and deduplicating work, as well as having that separate side of things where you can actively do outreach and connect to local manufacturers. That was what I wanted to share, and yeah, thank you.
Great. Anybody else have any last Horizon observations or experiences they want to share out before we close it down?
I can say one or two things.
Great. Why don't you introduce yourself first, Victoria?
So I'm Victoria, and I'm the other half of the medical team that works alongside with Angela. And I am one of the people that combs through Facebook and the wilds of the internet to pull designs for our medical supply guides. And I can't answer directly a lot of the questions in the chat. I do think that perhaps in the future there should be a local response call where we just talk about gowns, because I know there's a huge difference between makerspaces handling disposable gowns and washable gowns. And my focus for the past 2 weeks has been pretty much solely focused on trying to find places that are making gowns successfully of both kinds. And I know the questions that you have and the challenges that are out there. As a major theme that touches all of these concerns, we often look to government agencies or lawyers or different places of authority that we want to have the answers from. And that's definitely important, you know, especially talking about following EUA guidelines. But a lot of those places themselves do not have the answers immediately the way we want them, because this is a moving target. This is an event that has never happened before on a national or global scale. So even the most knowledgeable lawyer may be hard pressed to answer the question as detailed as we want it to be answered. So that is definitely a challenge, where as this thing moves, because COVID moves very fast and the needs grow very fast, these more stable questions that we have are challenging. I just want you to know that I understand that, and there's a lot of shifting sand in regards to that, where it's hard to find the answers. as quickly as the virus moves and we're trying to get in front of it. So that's all I want to say.
Awesome. Thank you, Victoria. Guy, do you want to share any last thoughts?
Yeah, I think if y'all take, one message away, I want it to be that, you need to be taking care of yourselves. You need to be taking care of your volunteers. You need to be taking care of the people who are making things. And you need to start, if you can, pulling yourself out of emergency mode a little bit and start thinking about what does it look like for you to do this for a long period of time? Or do you need to just stop, right? And, I want you to very, very specifically start having those conversations and having those thoughts, because I think this is a marathon. I think the answers include things like getting rest yourselves. I think the answers look like, reaching out locally to traditional manufacturers, reaching out locally to traditional suppliers, right? Reaching out to locally to people who can help, to delegate to, right? And I just encourage y'all to take a look at the larger picture and say, okay, am I still here in 12 months? Am I doing this, right? Am I not? If I'm not, am I handing this off to groups that can, right? Because again, my fundamental perspective is that if you have an exponentially growing disease, you have an exponentially growing demand, and you can't linearly add volunteers to deal with exponentially growing demand, right? None of y'all, or maybe some of y'all are, but none of y'all are necessarily able to provide for that entire demand, right? So how do you make friends? How do you build capacity in ways that don't look like, working volunteers longer or adding volunteers or burning through them? I'd say that'll be my big focus and desire for you guys to think about if you can.
Great. I hope we can do some more of these in the near term. It sounds like a very clear call for a gowns discussion, which that sounds ripe for conversation and sharing. Shoshona's asking weekly. I think that's kind of my thought, is that we at least come up with one themed conversation per week with a few people with expertise in those areas to help frame the conversation, and that we go from there. So I'd love feedback, and our channels are here if you guys have specific requests. And again, really appreciate you guys joining. I will share out through these channels the link to this video if you feel like it's worth sharing with other colleagues. There's a lot of people who are on here with lots of experience making and delivering supplies that didn't speak up. So I'm very curious to create some more opportunities for them to share. And excellent. Be well, be safe.
Thank you all so much for all the work.
Thanks,
you're doing.
guys.
Everybody.
Bye.
Thanks, everybody, for doing so.
Thank you. Bye.
Bye.
Thank you. Have a great day. Bye.
Bye-bye.
Thank you. Thank you. Bye bye.
Ciao.